So hi everybody, welcome along to this Ayurvedic webinar in our series of Ayurvedic webinars. My name is Noel O'Neill and I'm a director of the Ayurveda Centre. And this evening our webinar is going to be on the Ayurvedic approach to dealing with hemorrhoids. So for anyone that's ever had them, they're a nasty little condition. They can be very, very uncomfortable and it's something that can reoccur in people's lives, or it can be something that just comes up once in their lives. But still, it's very nice to know that there is an Ayurvedic approach to dealing with them. And this evening we'll be looking at what that is and why Ayurveda says people get hemorrhoids and what they can do to prevent getting them and what we can do if we do have them as well. So Ayurveda, just for the new people to this, Ayurveda is made up of two words. Veda means knowledge and Ayu means lifespan. So Ayurveda means the knowledge of lifespan. It's reckoned to be one of the oldest traditions of healthcare in the world. And essentially, it sees health in terms of balance and ill health in terms of imbalance. And so, disease is, if we look at the word disease, it's disease. The system is no longer at ease with itself. Fundamentally, though, the very unique thing about Ayurveda is it sees that no two people are the same. Everybody's an individual. Everyone has different characteristics and different traits. And an Ayurvedic doctor in India, to become an Ayurvedic doctor, it's a 6-year degree course. It's called a BAMS, a Bachelor of Ayurvedic Medicine and Surgery. And an Ayurvedic doctor is trained to, tell the telltale signs of what sort of a person that there is. Like we all know, we have different temperaments. Some people may be prone to get angry very quickly. Some people are much more placid. Some people are maybe prone to put on weight very easily. Some people can eat all around them and don't seem to put on weight. Some people have very thin frames, some very solid frames. So all these different characteristics show up within people. And staying in balance, it's very important that you know your nature. And then based on the nature that you have, you're able to choose things from life, the exercises, the food, all these things that bring balance to yourself, as opposed to put you out of balance. So what suits one person is not necessarily what suits another person. And a little later on, towards the end of the webinar, I'll show you where you can do a free 7-lesson online course, which explains all the basic principles about Ayurveda. But for now, we're going to move on to this evening's topic. I want to introduce you to Dr. Chaitrali, sorry, Dr. Chaitrali, I just stumbled over your name there. She is an Ayurvedic doctor from India. She's been in Ireland for a good few years now, and she also worked in Singapore in an Ayurveda Centre in Singapore. So she's a very, very experienced Ayurvedic doctor, and she's going to talk about this particular topic this evening. So, Dr. Chaitrali, you can go ahead.
Okay, thank you, Noel, and good evening, everyone. So thank you for joining today. I'll just start sharing the screen. Yeah, I have sent you the request, Noel.
Yeah.
Okay, great. Okay. Yeah, hope it is visible to everyone. Yeah, you can just thumbs up.
Sorry, yeah, I muted myself. Yeah, it's visible. Now the slides are at the side as well, so I don't know if you want to put it into slide mode, but it's clearly visible anyway.
Yeah, I'll put it on the slide mode. Yeah, now it is on the slide mode.
Yeah, that's it. Perfect.
Yeah. Okay. Okay. Yeah. So good evening and warm welcome for this webinar. So today's topic is a holistic approach to healing hemorrhoids naturally. Okay, so it's a little awkward situation for most of the patients, and no one openly discuss about this disorder. And that's how, like, I'm going to explain the Ayurvedic view and the modern view, how hemorrhoids should be dealt properly. Okay, so moving forward, so what is the objective of this webinar? So it is like today's session is to give the holistic understanding of hemorrhoids from both modern and the Ayurvedic perspective. So I'll talk about what are the causes, then different types of hemorrhoids, and then common symptoms, and how Ayurveda explains their formation, starting from digestive disorders or weak digestive system or weak digestive fire, leading to like manifestation of pain and bleeding piles. Okay, so you'll also learn about the natural and the safe and the practical Ayurvedic treatment approaches, some very effective home remedies, dietary tips, and lifestyle habits like which you have to take care of yourself, self-care practices, yoga and pranayama, and even the meditation as well. So the goal is to empower you with knowledge and the practical solutions using the time-tested wisdom of Ayurveda. Okay, so it is a holistic approach involving herbs, diet, lifestyle modification, and behavior correction is used to treat it. So it is called as a holistic approach. Okay, moving forward, let's see what is hemorrhoids. So according to the modern science, it is the swollen and the inflamed vein in the rectum and the anus causing discomfort and bleeding. So, and in Ayurveda, it is also called as Arsha. So the meaning of Arsha in Sanskrit is known as the enemy within the body. So it acts as an enemy within the body, which causes discomfort, and that's why it is named as Arsha. And then the outgrowth in the anal region causing discomfort, pain, and bleeding is termed as Arsha. So the classical definition in Ayurvedic text is also given here, a condition where the muscular or the venous growths appears at the anal opening or inside the rectum, leading to pain, bleeding, and difficulty in passing stool. Okay, so basically here Ayurveda treats most of the disorders with the digestion. So the digestive fire should be corrected well, and the disturbance in the digestive fire leads to many of the disorders, and we'll be seeing ahead how it is. So this is how is the view of Ayurveda looking at hemorrhoids and how it is developed. Okay, so the weak or the low digestive fire, like which has been persistent for many years, so that builds up into toxins like formed which are formed in an undigested food manner. Okay, and that is called as ama formation. So this undigested food which has been building up toxins in your digestive system, in the intestines, that leads to dosha imbalances. Like there are three types of doshas, the vata, pitta, and the kapha. So there is imbalance of these doshas, and then these toxins accumulate in the large intestine, and which is called as pakvasha in Ayurveda. So this ama gets accumulated into the large intestine, and thus the constipation occurs, and there is hard stool formation. And because of this, the person tends to strain a lot during the defecation or passing the motions, and therefore there is incomplete evacuation of bowels. And this leads to like a lot of straining and the hard stools passing through the anus. It swells up, or it causes inflammation in the surrounding areas of the anus, and that's how the veins starts to erupt down in the downward direction. Okay, so these outgrowths of the veins develop into the anal region, and thus the symptoms like pain, bleeding, or even the prolapse of these veins are called as external hemorrhoids are seen. So this is how is the Ayurvedic point of view looking at hemorrhoids, and this is how the hemorrhoids are developed after a few years if they are not treated well, or if the care is not taken at a proper time. Okay, so let's see forward, like Ayurveda classifies these hemorrhoids or arsha based on the dosa predominance. So the vataj. So what vataj are usually like when there is a predominance of vata dosha. So increase of wind element. So dry, it is usually dry, hard, painful, and blackish in coloration. And when excessive intake of, again, dry food, or excessive intake of light and dry and cold food intake leads to increase of vata dosha. And that's how this hemorrhoid is considered to be dominant with this vata dosha. Okay, and then pittash type of hemorrhoids, they are usually inflamed, red, bleeding, and with burning sensation. So these are the symptoms which are seen in the pittash dominant hemorrhoids. And again, these are caused due to excessive intake of spicy food, or a lot of chilies, or even cold salads sometimes aggravate vata and pitta both, and thus leads to constipation, and even fried food as well. Then in Kafaj hemorrhoids, it is usually slimy, pale, soft, and little heavy when you feel that. So this is again caused due to intake of a lot of oily and stale food. So intake of very oily, heavy to digest food leads to this kind of hemorrhoids. And then it is the third type is where all the three doshas are involved together. So that is called as Sannipataj. So where all the three doshas are involved, and there are mixed symptoms. Sometimes there is like hard stool, sometimes there is mucus, sometimes there is bleeding. So there are like mixed symptoms which are seen, and this is more severe condition where you have been like not taking care of yourself properly, and that leads into aggravation of all the three doshas here. And then the last one is Ayurveda talks about the congenital hemorrhoids as well, which is usually seen during the birth defects. Okay, so in these congenital uh, hemorrhoids, there's no proper cause, like because of what it is causing, but it might be because of during the pregnancy, if the lady is not taking care of herself properly, that might lead into the congenital hemorrhoids. Okay, so moving forward, let's see, there are again few types of hemorrhoids according to the base of the site. So the base of the site, like if it is internal hemorrhoids, they are inside the rectum, which might not be visible, but it might cause bleeding. A fresh bleed is usually a sign of hemorrhoids which are very early. And these when there are like internal hemorrhoids, you might uh, find a symptom of bleeding piles as well. Okay, then external hemorrhoids are also seen when they lean downwards, when they move downwards under the skin around the anus, and which are like painful, and they might be sometimes bleeding or they might not be. Okay, and the third type is the thrombus hemorrhoids. So where the blood clot formation is formed, and it's really very painful. Sometimes there are like emergency conditions when these kind of hemorrhoids are seen. Okay, and moving forward. Yeah, so according to the stages and the grades of hemorrhoids, so the modern view, there are like grade 1 where bleeding, but there is no prolapse. Yeah, there's a symptom of bleeding, but there's no prolapse of that hemorrhoid which is there internally. You can see in the figure. Then if it is grade 2, prolapse with spontaneous reduction. So, and then grade 3 is prolapse requiring manual reduction, and grade 4 is irreducible prolapse. So this is just to know, like these are the types of hemorrhoids. Now let's see, this is really very important. So the causes of hemorrhoids. So from a modern view, causes include like chronic constipation, prolonged sitting for longer time during the bowel movements, straining during the bowel movements, and then even desk job, sedentary jobs, and low fiber diet, obesity, and pregnancy. And even according to Ayurveda talks about the improper meal time and sleep time. If you are not following the circadian rhythm properly, that also disturbs your digestion, which hampers your digestion, and it leads to like weak digestion, which is called as Agnimandya. It's the main causative factor according to the Ayurveda. And then excessive intake of dry, cold, and even the stale food, spicy and heavy food, excessive consumption of alcohol, So these are the contributory factors leading to weak digestion as well. Okay, and that's how it forms into constipation. Then improper lifestyle, like sitting for long hours. And again, one more thing is like suppressing natural urges. This is what Ayurveda talks about. So the natural urges like even defecating, like even passing stool or urine when you are in the office hours and you hold on with these natural urges, these tends to increase that vata dosha which is there, which has the action of excretion from your from the anus, and that's where the vata dosha tries to accumulate a lot, and that leads to constipation, and that's how hemorrhoids are formed. So suppressing natural urges is one of the very important uh, cause, I would say, according to Ayurveda. And then lack of exercise or physical activity, and even sleeping during the daytime is also not really good for your digestion. Then overexertion and heavy lifting. So this might also lead to like prolapse of those veins, or even those veins coming out of the rectum. So try not to, like, if you feel like you have hemorrhoids, so try not to over exercise or even lifting heavy objects. And then again, sedentary lifestyle, even professional drivers, sometimes they are like sitting for long time at one place. So even they are tend to they have a tendency to have hemorrhoids very frequently. Okay, and even emotions, emotional upset and even grief during eating is also considered to be one of the positive factor, leading to weak digestion. Okay, so moving forward, is it going ahead? Yeah, I guess we are far ahead. Yeah, after causes, the symptoms. So the symptoms of hemorrhoids are difficulty passing the bowels or the stool, that's constipation, feeling of incomplete evacuation of bowels, bleeding per rectum, fresh blood. Usually this is seen when the hemorrhoids are developed at the initial stage. Then pain during pain and even burning sensation while passing motions or afterwards. Itching and irritation at the anal region. This is also one of the very common symptoms. Then mucus discharge in some cases where there is kapha dominant in your case. And then palpable hemorrhoid outside the anus, like prolapse and inflamed lump, which can be felt. So let's see what are the Ayurveda treatment modalities. Okay, so Ayurveda talks about the palliative treatment first. It is like the herbal medications to balance the doshas or the digestive fire corrections. So Ayurveda talks about the appetizer and the digestive fire kindle uh, herbs, which are like, which stimulates your digestive fire and it enhances the digestive fire. It helps to enhance the digestive fire. Then there are good carminative herbs or even detoxifying herbs, which are really good to detoxify the toxins which have been accumulated for longer time in the digestive tract. Okay, and then there are like local treatment. So the first line of treatment is the palliative treatment, then the local treatment for the pain and inflammation. So seeds bath is really a good remedy to do with, and I'll be talking more about it in the home remedies. So seeds bath is usually done with different herbal decoctions or even the lukewarm water along with any oils. So I'll be talking ahead. And then application of herbal paste or herbal oils is really good. So these are like anti-inflammatory herbs like turmeric and even ghee or even jatyadi oil. So these are the oils which are helpful to reduce the pain or reduce that vata which is causing pain there, and to reduce the burning sensation as well at the site. Okay. Then even Ayurveda talks about the Agni Karma or the fire cauterization. So that is also done in the rare cases like where the hemorrhoids are really dry and they are irritating at that site. So this is done under medical supervision, and it is again a parasurgical treatment, which is like done in few hours and then the patient goes home. So it's quite safe. And again, there's one more non-surgical treatment which is called as Kshara Karma. So it is chemical cauterization. So Kshara Karma is a specialized Ayurvedic parasurgical procedure used primarily in the treatment of these hemorrhoids or even in fistulas or any overgrowths. So these Kshar is usually, it is a alkali-based chemical cauterization technique using a herbal alkali preparation known as kshar. So there might be like different kshar of apamarga or arka or snuhi. So these are different plants in Ayurvedic text which have been mentioned, and these kshars are applied topically using a cotton bud directly on the pile mass and cauterizes, and that's how the cauterization is there. This chemical dissolves the pile mass and causes minimal bleeding and again promotes healing with minimal recurrence. So that's why these techniques are really very helpful for hemorrhoids, and they're quite safe and effective, and non like the patient can go home within a day, and even the recovery is quite soon. And then Ayurveda even talks about the last treatment modality, that is surgical method. So if none of the above is suiting the patient and it's causing a lot of discomfort, so the surgical method is also opted in few cases where it can't be cured with above mentioned methods. Okay, but that's like the very last we would say option to go for, because again after doing surgery it's not like the hemorrhoids will not come back. So there are lot of recurrences, like chances of recurrences like 50 to 60% of recurrence chances, because again if your digestive fire is not kindled well or if it is not taken care well, then surgical method is also not going to help you for long term. Okay, moving forward. So these are the Ayurvedic herbs and formulations which are really helpful to, like there are good digestive herbs and there are good laxative herbs, there are anti-inflammatory herbs here, and which enhance the digestion and relieves constipation, improves the bowel movement, and even heals and controls the bleeding as well. So Triphala Churna or Haritaki, then even Bilva is one of the good digestive herb, then long pepper, roots of long pepper, then coriander, amla. So amla is one of the wonder herb. I would say it's a rejuvenating herb. I'll be talking about it later in the dietary section as well. Then turmeric is also a good antiseptic, anti-inflammatory, and immunomodulator herb. Then Google is also a good anti-inflammatory and anti-analgesic, like pain relieving herb. Then we do have like herbal formulations like Triphala, then Gastro Support, Herbal Digest, Digest Plus, Herbal ACI Balance, Herbal Cleanse, even castor oil. So I'll be talking about the castor oil in home remedies. Then Panchatikta Ghritam, which is also a good detoxifying ghee, I would say, which is usually used during any of the spring detox or the autumn detox. So we usually use this ghee in any of the detox therapies. And Panchatikta is like, Pancha is 5 and Tikta is the bitter herbs. So these are like, this is a ghee which includes 5 bitter herbs into that. That's how it is a good detoxifying agent. Then Jata the oil, which can be applied externally. This is a wonderful oil, I would say, if anyone is having like pain and inflammation at the anal site. So that Jata the oil is really good for any of the hemorrhoids and piles. Only thing, like, be careful if you are taking these medications, don't self-medicate. It's always better to consult a Vaidya or any of us and take it under supervision. Okay, now this is the main highlight of the webinar. So home remedies. So if you can see here in the picture, like the seeds bath. So seeds bath is really good to take before passing motions and after passing the motions, so that it relieves the pressure which is there on the anus. It relieves the anal sphincters as well, and that's how it is really good to good to have it before passing the bowel movements, and it's always good to have it after passing bowel movements because it helps to reduce the pain at that site and even the swelling also. Okay, so you can use like a lukewarm water, and even sometimes you can even put in like 2 or 3 pinches of turmeric powder into that lukewarm water and sit in that. Then you can even use triphala powder, or triphala decoction is a better option to make a decoction. Like if you just take 3 to 4 liters of water, boil it and put like 3 tablespoons of triphala powder into that, boil it well, and then you can use that water as a sitz bath. Okay, and yeah, and then aloe vera gel. This is also a good remedy to apply it locally, so that it helps to relieve that burning sensation, and even if there is pain or discomfort. Then soaked black raisins and dry figs. So to have these soaked black raisins, like you can have 1 tablespoon of these soaked black raisins overnight. You have to soak them, and in the morning you can have them. Or even the dry figs. So 2 figs, you can soak it overnight, and in the morning you can have those figs. So these are really very good laxatives, I would say, and they help to improve the gut microbiome, and that's how they ignite your digestive fire and relieve the constipation as well. So black raisins and dry fig are really good to take in the morning time, at least for a month or so, to regulate your bowel movements. Then triphala powder, or even haritaki powder. So triphala powder can be taken, or triphala plus tablet can be taken at night, 1 teaspoon along with warm water. So this also ease the bowel movements. Or even you can mix triphala powder along with ghee and have it with warm water if it is a lot of vata conditions. So you can mix it with the ghee and have it. Then haritaki powder. So this is a wonder powder for like the bleeding piles, or even if you have pain and inflammation. So haritaki along with jaggery. So 1 teaspoon of haritaki and 1 teaspoon of jaggery powder. You can just mix it together and just have it before meal. So drink warm water over it and take it before your meals, like morning and evening, 2 times. Then even licorice powder, it is sweet in taste and easy even for the kids to take if they have like constipation for a longer time. So licorice powder, mix it with water and ask them to drink, or licorice powder along with ghee, and drink warm water over it. So these are good laxatives, and even they are helpful for your digestive system as well. Then buttermilk. So buttermilk is also considered as one of the herbal probiotic, I would say, according to Ayurveda. So that is, buttermilk is nothing but the salted lassi. So you just have to like take 1 tablespoon of yogurt, plain yogurt, and mix 1 glass of water into that, whisk it well, and then you can add in like little bit of salt, cumin powder, coriander powder. So these are good digestives. So you can mix it together and then have it along with the meal is better. Or else if it is a kapha condition, maybe, then what you can do is like you can just grate a little bit of ginger into that and a little bit of black pepper powder. So that will also ease the kapha. Okay, then castor oil with warm water or with warm milk. So 1 spoon of castor oil with warm water at bedtime will help as an laxative, and this will ease the stools in the morning. So it's better to take it along with warm water or warm milk at night. And then local application. So local application, if there is a lot of pain and burning sensation, and if you feel that the bile mass is inflamed, then application of normal ghee, clarified butter, will also help and ease those symptoms. If it doesn't help that much, then maybe you can mix the turmeric and ghee and make a paste and then apply it. But again, be careful. If it is like a bleeding pile, you should not use turmeric. Only ghee should be okay with it. Then, because again, ghee, it reduces all the 3 doshas, but it is really good for the pitta dosha. Okay, and this is how like ghee reduces burning sensation, pain, and it is like natural anti-inflammatory and antibacterial. And you can just see in this picture, like there are natural home remedies for constipation. So having like prunes, figs, and even carom seed water or CCFT also helps to really like they help to remove the toxins, so, and even help to ignite the digestive fire as well. And even the mint leaves, which are cooling for your digestion. So these are the few home remedies which can be done if you are suffering from hemorrhoids. Okay. Let me just go ahead with the dietary tips. Yeah. So sick. Yeah. So high fiber diet. High fiber diet is really very important. So fresh green leafy vegetables. So when we talk about like leafy vegetables and fruits, so the modern view is like even in modern science, they say that the vitamin C is really important for stool formation, or it is a potent antioxidant. Okay, so like oranges and berries and even amla, Indian gooseberry, they support collagen production, which strengthens the vein walls and reduce the bleeding. So it also reduces the inflammation and oxidative stress in the rectal tissue. It improves the blood vessel integrity, preventing further damage or prolapse of those veins. So that's why these like vitamin C containing oranges or berries or amlas are really very important to include in your diet. Then this amla is again a wonder herb. It's an anti-aging or rejuvenating herb according to Ayurveda, as it balances all the 3 doshas. It promotes the digestive fire and helps regulate the bowel movements, preventing constipation. And again, it's a cooling and a detoxifying. It has a detoxifying properties, reducing bleeding and inflammation as well. Okay, and then when I talk about the fruits, yeah, okay. Sorry, there was some disturbance. Okay, so when I talk about the fruits and even some vegetables, there are like natural flavonoids into that. So like creusin is one of the flavonoid, which is seen in apples, then red onions, grapes, especially red and purple grapes, then tomatoes when they are de-seeded, and berries like blueberries and blackberries, and even kale and leafy greens. So these all have a good anti-inflammatory properties, antioxidant properties, and they strengthen the blood vessels. So, and also reduces the excess pitta or the fire content, or even any blood impurities which are there. So that's how they are natural detoxifying agents and anti-inflammatory. So you should include these 5 things in your diet. Okay, even having fresh and warm food is really important, because cooking fresh and having warm food is like very good for your digestive system. It is light on your tummy, and that's how most of the enzymes are digested well. They are secreted and absorbed well into the bloodstream. Okay, then sipping herbal teas and drink warm water, that is really important. Then using ghee regularly in your diet, at least 1 to 2 teaspoons each day. You should include ghee. Then including spices in cooking meals. This is really very important. So I want to talk about spices here. So spices aren't just the flavors. So spices are nature's pharmacy, I would say. And in Ayurveda, they are used to enhance taste and promote health. So regularly using these digestive spices like turmeric and even cumin, coriander, then ginger, garlic, fennel, and black pepper, it helps to stimulate your digestive fire, and it promotes a healthy gut microbiome, and it prevents from toxic accumulation. And that's how they are like detoxifying, and they balance all the doshas as well. They improve the metabolism and the nutrient absorption as well. And they even, like if you see in this picture, there's asafoetida, so that helps to reduce the gas and bloating and indigestion. So that's how these all spices are like wonder kitchen herbs, I would say. And you should try to include at least once or twice in your meal every day. Okay. Then even salted lassi, buttermilk, I talked about it earlier. Then avoiding spicy, fried, processed food, leftover foods, and avoid incompatible food items. So this also Ayurveda talks about like the food combinations which you are having sour fruits and milk together, or like fish and milk together. So, or marinating any of the non-veg items is really not a good idea to mix in. So these combinations don't go well. Even heating honey is also incompatible according to Ayurveda, because it produces a toxic kind of substance in the digestive tract, and which is not easily digested, and they keep on staying into the tract for longer duration, and thus leading to these all disorders. So avoid caffeine and alcohol as well. So these are the dietary tips. So moving forward. Yeah. So this is also one of the important slides. So there are like 3, 4 slides which are really important. So what are do's and don'ts for the lifestyle modification? So the do's are like eat high fiber and warm cooked food, ensure proper meal times, then drink 2 to 3 liters of water daily to soften stool. So try to drink like the normal water or warm water. Try not to have the cold water, because again cold water is going to hamper your agni or the digestive fire. Okay. And try to sip between your like try to drink water between your meals, not before or immediately after your meal. Okay. Then establish a regular bowel routine. Go when you feel the urge. Don't suppress your natural urges. Then include mild exercises like walking and yoga postures, which I'll be talking ahead. Then take warm seats bath to relieve itching and swelling. Use a footstool while defecating to ease bowel movements. This is also a really important tip. Then take short breaks and walk around regularly during long hours of sitting, and practice stress management. So this is again really very important, because there is a gut and the brain axis, wherein the nervous system plays a major role here. So when you are, if you just take an example, when you are really very angry and you have food in front of you, you just don't understand what you are eating, and you just keep on gobbling a lot of things at a time. So this is how the mind plays an important role for your digestion as well. Okay. So try to manage your stress, anxiety, or fear or depression, any kind of mental disorder. Okay. Then let's move toward what are the don'ts. So avoid straining or sitting too long on the toilet. Don't suppress natural urges like the urge to defecate or urinate again. Then limit cold salads and cold food items like sandwiches, cold sandwiches or cold pastas. So again, this is going to hamper your digestion a lot because being Ireland being a cold country, here the digestive fire is not that great. And if you're having more of cold stuff, that's going to hamper your digestive fire. So the our tummy or the digestive fire needs something warm and really fresh to digest it well and easily. Okay, then limit to the spicy and fried, oily and heavy processed foods. Avoid prolonged sitting or sedentary work without breaks. Avoid sitting on a hard surface chair for a longer duration. So this is also one of the positive factor, which Ayurveda highlights a lot on that, because he's sitting on the hard surface. Also, it brings in an uneasy position, and that's how it tends to aggravate that veins which are dripping down from the anus, like which are prolapsed from the anus, and they get irritated, and that's how it increases more of friction and hemorrhoids might increase. Okay, so sitting on the hard surface is also not recommended. So try to have something comfortable and soft cushion under your on your chair. So don't lift heavy weights or perform high impact exercises during flares up, and refrain from alcohol and smoking. They aggravate pitta and the digestive issues. And do not ignore constipation or leaky gut or any digestive issue. So these are the lifestyle modifications, and you have to keep in mind, like, we don't have to do this and we have to do this. So just keep this in mind. And these are the yoga postures, which are really helpful to improve your digestion. And even to it also helps to, like, make the pelvic floor muscles strengthen the pelvic floor muscles. So like Vajrasana. So Vajrasana, or the thunderbolt pose, or the diamond pose. So this is the one of the pose which is not in the picture, but you might be able to see it on the Google. So this Vajrasana is one of the pose which can be done immediately after having your meals. So you have to sit in this position for at least 5 minutes. So it helps to aid more of digestion. Okay, then the Malasana, or the garland pose, which can be done early in the morning. When you wake up, you can have a glass of warm water in this position, which helps to ease the bowel movements. Okay, then Pavan Muktasana, or which is called as the wind relieving pose. This is also really a good pose for the digestive system and to strengthen your digestive system as well. And it helps to improve the bowel movements, relieve the gases and even the bloating, and even improves the venous return and relaxes the body. Okay, leg up the wall pose. This is also a really good pose where we are all the time standing and all the blood gushes down. But there are no, so in this position, what happens is, like, when you keep your legs to the wall, it helps all the blood vessels draining into your pelvic area, and thus the circulation improves there. And that's how it works on the solar plexus, and it helps to improve the digestion as well. Then the butterfly pose is also really good to strengthen those muscles which are there in the pelvic floor, and thus to aid the digestion as well. And the sun salutations, wherein all the positions are there, the forward bending, backward bending. So these all helps in aiding more digestion and circulation in the body. Okay, and it is for excretion of motions. Okay, moving forward. Now, this is one of the second last slide, I would say. So what are the preventive measures which can be taken, like follow proper daily routine, like proper time, according to the circadian rhythm. And then seasonal routines, following seasonal routines is really important. Then the balanced diet, daily bowel movement without straining, and then early treatment of digestive issues. So this is really important. And do not ignore any of the digestive issues, or mainly the constipation, which is really very common nowadays. And engage daily in any kind of physical activities and manage your stress. So stress management is one of the very um, uh, what I would say is like that's the main factor which is causing a lot of stress and anxiety, leading to digestive disorders, I would say. So try to manage your stress properly, meditate regularly, do breathing techniques. So breathing techniques is also helps to detoxify your body in the form of breath. So you are exhaling out all the toxins from your breath. So this is how these are the preventive measures which one should take when you are dealing with hemorrhoids. And yeah, so yep. So this is the last slide, and I would like to put a phrase from Charak Samhita. So Charaka is one of the ancient scholars of Ayurveda, and in his text, he says like all diseases begins with weak digestive fire, and there is no doubt about it. So kindle your digestive fire, work on your digestive fire, and that's how you're going to get better and better day by day. And this is how I conclude my webinar, saying balance your digestion, balance your life. Ayurveda says it's key to longevity. And thank you.
Great, Dr. Chaitrali. Yeah, that's very, very comprehensive overview there. I mean, like many things in Ayurveda, it comes back to digestion, strengthening the digestion. And, I was looking at the slides that you were putting up there and the advice that you were giving there. And I would feel that if people followed that advice, not only would it have an impact on their hemorrhoids in dissipating that particular disorder, but it would have such a positive impact on their life overall. And I like every disease that may be there, because, hemorrhoids is just one manifestation of an underlying imbalance. And there may be lots of other imbalances that are capable of coming forward. But doing the things that are suggested there, like with eating the fresh vegetables and avoid processed foods, and like so much disease nowadays is just caused by bad diet and lack of exercise and just completely lifestyle orientated. And so it was really great to hear that. I think people can get profound benefits. Of people who already have hemorrhoids, who are in that situation. You gave some great advice there. I know you asked me to stock a particular oil, which I have ordered from a supplier. I think you told me where I could get it, and I have some of them coming in. What was the name of that oil again?
It is Jatyadi Tailum, Jatyadi oil.
Jada D oil. That's for external application, yeah. And I should have that in. I should have it in. It's ordered, so it should be. I should have it in maybe next week sometime, and I'll put it up on the website so people can access it. And so I want to share my screen with people as well, just for a second. I want to bring them to where they can find out a lot of information. I'll just share this screen here. Can you see that screen, Dr. Chaitrali, the Ayurveda website?
Yeah, I can see. Yeah, we can see
Okay,
that.
so our website is just called ayurveda.ie. So you can see it up there in the top left, ayurveda.ie. And when you go on there, we have a whole load of, we've done lots of webinars on lots of different topics. Okay, so you can see free webinars one, you can see we've done dementia, brain health. But here there's an online course. It's also up top here. It's something we promote very strongly. So for anybody that hasn't done this course or maybe wants to do it again, it's a 7-lesson course, and it gives an introduction to Ayurveda. It has a discussion on Vata, Pitta, Kapha. I know for new people, they might not understand what they are. Dr. Chaitrali talked about a Vata type of hemorrhoid, a Pitta type, and a Kapha type. This webinar goes in to explain these things in very deep way, because as I said at the beginning, the main thing that Ayurveda does is it recognizes that we're not all the same. We have different personalities, we have different body types, We have things affect us. Some people can't handle the cold. Some people are very good in the cold. Some people can't handle heat. Some people like heat. So we're all different and things affect us differently. And by knowing your nature, you can know what to choose from nature that's good for you and what may put you out of balance. So that course is really, really well worth doing if you want, and it also goes into the daily and seasonal routines that Dr. Chaitrali talk about. So I would advise everybody, you just have to register for it. It's free. We have some brilliant testimonials. We've had maybe more than 25,000 people register to do this course over. We recorded it during lockdown and COVID, and we used to have, 2,000 people doing this course with us at any one time, and we ran it several times. So we've had lots of people doing it. It's a really brilliant course, and it gives you a great, great understanding of what Ayurveda is. If you have other things that you're interested in, we have a long list of webinars. I have some I haven't even put up here, but I will do in the next few days. So you have things like arthritis, anxiety, psoriasis, sinusitis, tinnitus, and then over here you have another whole list on menopause, endometriosis, and these are all the Ayurvedic approach to these conditions. They're how Ayurveda approaches these particular things, how it recognizes them and how it treats them, and what imbalance is causing these things to come along. And Ayurveda is always, always primarily about prevention. So if you can prevent these things from happening in the first place through good lifestyle and through good diet. But unfortunately, we tend to live in a society where we don't really bother think about our health too much until it starts to leave us and we start getting problems. But even then, it's not too late to reverse those things. It's always better if you can get them earlier, or get them before they've even manifested themselves. But even if they have, there's always lots and lots of things that we can do. So that's just the website, ayurveda.ie. For people in the UK, the website is aruland.co.uk. Just Aruland. I'll just put it in over here. I'll show you. It's exactly the same website. It's the same basic structure, but we have a Dr. Brennan, who is one of our main doctors. He's a medical doctor as well as an Ayurvedic doctor. He lived and worked in the UK for many decades, and we have a huge contingent of Ayurvedic participants from the UK. So we have a UK website. Basically, any of the products that we sell on this website are priced in sterling, just to make it easier for people. But other than that, as you can see, it's the same website. And if you would like to have a consultation with Dr. Chaitrali yourself, if this is a condition that you feel you'd like to have a consultation about because it's something that's causing a lot of discomfort in your life, you can see her phone number and her email address there. Probably really best to email. She mightn't be able to answer her phone if she's doing consultations. So you can just drop Dr. Chaitrali an email and she can have a personal consultation. We do a lot of these general webinars, but we always advise people that if there's something serious going on, or that it's always better to have a private consultation and to get a really good path to be put on, and that can be followed up on as well. But anyway, that's our website, so you can go there. You can also, at any stage, if you're not on our newsletter, you can subscribe to our newsletter. But I think most of the people on the call this evening are already on our newsletter. But if you're not, if you're watching this back as a replay sometime in the future, you can always just register and we'll keep you informed of all the events that we have going on, So let's just see. I'm going to stop the share and I'm going to go to the questions. We'll spend a few more minutes on this. So JZ said, "Oh no, missed the beginning. Will there be a recording shared?" Yes, we always share recordings of our webinars. So we'll send that out to not tomorrow, on Saturday. It'll go out in our newsletter. Dr. Yamini, are you hiring Ayurvedic doctors? We're not, Dr. Yamini. What we do with Ayurvedic doctors is they tend to be self-employed. In most cases, not in all cases, because sometimes the visa requirement won't allow that. But we help Ayurvedic doctors establish their practice, and we give them a lot of support in any particular area. So if you're already in Ireland and you'd like to establish it, and you're qualified in Ayurveda, by all means, if you're a medical doctor that's interested in Ayurveda, definitely get in touch with me, because there's a brilliant course that you can do that will, it's from the Alma Mater University in Slovenia, that will get you all trained up on how to do Ayurvedic consultations. Can you share the picture, the slides, I presume, Eleanor? Yeah, we'll get a copy of the slides in PDF format, and we'll share them with the recording on Saturday. So Gillian says, "Thank you very much." Eleanor says, thank you, so clear and comprehensive. Siobhan says, thank you very much. Alice says, thank you very much. Stephania says, great information. Sarah, thank you. Thank you so much from Olive. Thank you, Dr. Chaitrali. Very clear, settled exposition of great knowledge. Thank you, Noel, for all the free webinars to listen to again. That's no problem. Will there be a recording shared? Missed the beginning. That's the second time you've asked that, but that's fine. Yes, we'll share a recording. There's no, I get lots of emails, people saying to me, oh, I won't make that meeting. Will there be a recording? There's always a recording. There's always a recording. So there's no need to, for future reference for anybody. There's no need. We do these webinars. We get a few people on. Maybe we get a couple of hundred people on. Depending on the topic and depending on the evening, and then we get thousands of views of the webinars later on. So, people can just watch them. And also there's a huge amount of information in them. So we'd have to supply the recordings because you wouldn't be able to take in all the information, And so we will send a recording. We put it up on our YouTube channel, and I'll send a link to that on Saturday so you can go through it. And we'll also get the slides as well in PDF format, So I think that's it. So I just want to say a big thank you to Dr. Chaitrali. You put a lot of effort into that. There's a lot of really, really great information there. And if anybody, as I said, wants a private consultation with Dr. Chaitrali, then you have her contact details there as well. I'm not sure what our next webinar is. We might even take a little break over the summer for the next little while, especially with the good weather. We just finished we didn't just finish, but we did our spring detox, which is over now. And we have some exciting programs coming up in the autumn as well that I was talking to Dr. Brennan about today. But we have all our other webinars, and I'll be making more of those webinars available for free on the website as well, So thank you very much, Dr. Chaitrali, for coming on. And thank you to everybody that joined in this evening as well. It's, what time is it now? It's 8:30, so it's still bright out here and it's a beautiful evening. So if you get a chance, one of Dr. Chaitrali's recommendations was to make sure you got some nice exercise, and taking a nice walk in the evening time is a really, really good thing to do. So thank you very much, everybody. Namaskar.
Thank you, everyone.
And,
yeah, stay well. Bye-bye.
Yeah. Okay, yeah. Dr. Chaitrali, thank you. I'll talk to you soon. And goodbye to everybody else. We'll catch up with you soon, Take care. Bye-bye.
Take care. Bye-bye.
Bye-bye.